My name is Joan Wallace Benjamin, and for 15 years I've served as the president and CEO of the Home for Little Wanderers. I just recently retired. I started my career 37 years ago, and the majority of the places I've worked have been nonprofit human services organizations that provide services to kids and families. 90% of the providers in the psychology and mental health field are white. And so as the president of an organization that provided mental and behavioral health services, I found it as its leader to be a major challenge, both in terms of the employees that we were able to attract and recruit to the organization, who was coming out of the graduate schools of social work and mental and behavioral health. That was a challenge because they were not particularly as diverse as you might want. And 92% of the people served at the Home for Little Wanderers were people of color. So we found it very challenging to create any kind of match between the employees that we were hiring to do this really important work with very vulnerable families and who the families were themselves. You know, if you think about mental and behavioral health and one's mental and behavioral well-being, that's really head and heart work. It requires an understanding of where people are coming from, what shoes they're walking in that may be different from your own. There are many families across the Commonwealth of color, for example, who come from different cultures and different backgrounds. They think very differently about mental and behavioral health, and so it really helps to have a mixed team of employees that can even guide one another around dealing with a Haitian family, and you have a clinician colleague of yours that's Haitian. That's very helpful to be able to garner some advice, experience, and perspective from your colleague in order to serve in a more appropriate way. While at the home, I established a relationship with William James College to help us think about how we could diversify our employee base and also take those employees that we had and give them additional training and orientation around a whole set of issues in psychology and mental health. The college so happens to have a wonderful initiative developing Latino clinicians. They've just started an African American initiative to develop African American clinicians. I mean, something so totally unique that this would be a wonderful feeder for an organization like the Home, both to get their graduates to come work with us, but also we had conversations about how to take some of our entry-level employees and get them ready with a bachelor's degree. Oftentimes at the entry levels and sort of at the direct care level in the field, we have people who have high school diplomas, many have associate's degrees, but they don't quite have bachelor's degrees because that is not a requirement at that entry level, but they would like to. And so William James had conversations with us about, well, how can we take some of your long-term, some people had been working with us for a long time, you know, living a life, coming to work. Life takes over, of course, and how do you fit school into a complicated life that employees have with their families and their own children? And we began really good conversations about how can we provide a credential, a bachelor's credential, to people who have already been working, doing really important work, but just did not have the credential that they needed with a bachelor's degree. And not that the people who don't have the bachelor's degree are not doing important work, because they really are. But we don't want the lack of the degree to stand in the way of them being able to continue to provide quality services to the families that they're serving. It's also true that in the field, people with a bachelor's degree can bill insurance companies for the clinical work that they're doing. And with an associate's degree, you cannot. So we have mixed teams of clinicians, some with master's degrees, unlicensed and credentialed, and then others with bachelor's degrees, but both of them can bill for the work for the clinical work that they're doing. The salaries as well for those people with bachelor's degrees tends to be higher than if you have a high school diploma or an associate's degree. So I can't say that the mental and behavioral health field is much different than many others in that way. The human services field is a wonderful career to go into. The work is rewarding. No day is the same. So it's a very diverse set of activities that you participate in. And at the end of the day, on a person-by-person basis, you can really see that you are making a difference.